The MORE Trial, Multiple Outcomes of Raloxifene Evaluation. Welcome to the Everything Surgery podcast, where today we are delving into the pivotal MORE Trial, the Multiple Outcomes of Raloxifene Evaluation. Our episode takes a close look at this landmark clinical investigation that forever changed the landscape of osteoporosis treatment and breast cancer prevention in postmenopausal women. Let us begin with the core objective. The MORE trial was designed to determine whether raloxifene, a medication classified as a selective estrogen receptor modulator, could reduce the risk of vertebral fractures in postmenopausal women diagnosed with osteoporosis. Beyond bone health, the trial also set out to examine raloxifene's effect on the incidence of breast cancer, a secondary but vital endpoint. To provide some context, the trial was sponsored by Eli Lilly and Company and commenced in 1994. It included over 7,000 postmenopausal women, with an average age of approximately 66 years, all of whom had osteoporosis defined by either low bone mineral density or a history of vertebral fractures. The study's design was rigorous. Participants were randomly assigned in a double-blind, placebo-controlled fashion to receive either a placebo, 60 mg of raloxifene daily, or 120 mg daily, for 3 years, a period ultimately extended to 4 years. Now, let us turn to the primary results. The trial met its principal objective. Raloxifene significantly increased bone mineral density and reduced the risk of new vertebral fractures by roughly 30 to 50%. The degree of risk reduction depended on the dose administered and the patient's fracture history. However, what truly set the MORE trial apart was an unexpected yet groundbreaking finding regarding breast cancer. After 40 months, raloxifene was found to reduce the risk of invasive breast cancer by an impressive 72%. This reduction was seen exclusively in estrogen receptor-positive tumors, with no observed effect on estrogen receptor-negative tumors. It is important to note that raloxifene did not reduce the risk of non-invasive breast cancers, such as ductal carcinoma in situ. Other significant outcomes included a neutral effect on coronary heart disease events during the main trial period. However, subsequent analyses, such as the CORE follow-up study, suggested a reduced risk of coronary events among a subset of women at particularly high risk. In terms of safety, raloxifene shared some risks common to other selective estrogen receptor modulators, including an increased likelihood of venous thromboembolism and hot flashes. Importantly, unlike tamoxifen, raloxifene did not raise the risk of endometrial cancer or uterine hyperplasia, marking a significant distinction in its safety profile. The conclusions were nothing short of transformative. The MORE trial established raloxifene as the first medication capable of treating osteoporosis while simultaneously reducing breast cancer risk. This secondary outcome was revolutionary, providing the clinical evidence that catalyzed the design of the NSABP STAR trial, which directly compared raloxifene with tamoxifen for breast cancer prevention in high-risk women. As a result of these findings, raloxifene received initial approval for the prevention and treatment of osteoporosis in postmenopausal women in 1997. Later, based on the MORE trial and subsequent data, it was approved for reducing the risk of invasive breast cancer in postmenopausal women with osteoporosis, and eventually, for high-risk women without osteoporosis as well. Mechanistically, the MORE trial solidified the concept of selective estrogen receptor modulators, that a single drug could act as an estrogen antagonist in breast tissue, preventing cancer, while serving as an estrogen agonist in bone, preventing fractures, without harmful effects on the uterus. In summary, the MORE trial began as a study focused on osteoporosis but became a milestone in cancer prevention by demonstrating that raloxifene dramatically reduces the risk of estrogen receptor positive invasive breast cancer in postmenopausal women. This pivotal discovery paved the way for raloxifene's use as a chemopreventive agent and reshaped standards of care. Thank you for tuning into the Everything Surgery podcast. If you found this episode informative, please like, share, and subscribe for more deep dives into the extraordinary world of surgical science and clinical breakthroughs.